And Swasti mainly currently works as a systems catalyst, not just working with government and communities, but also with the private sector and philanthropy. Climate issues, I think everyone would have experienced, and especially with the rising heat, air pollution, and the key thing which should not go missing in any of these reforms is focus on community and people-centric.
Hello and a warm welcome to a very special podcast series, Unusual Suspects. I'm your host, Gaurav Choudhury. This is a series about unraveling stories of entrepreneurs, investors, professionals, and philanthropists, of course, who are disruptors, yet not in your face. The disruptions have consistently delivered on the purpose and the mission they've embarked on. Their values are as strong as the mission. In each episode, I speak to one such leader, talking to her or him or them about their businesses, lives, inspirations, work, interests and challenges, pivot moments and turning points, and of course, the little joys of life and work. Unusual Suspect streams on Earshot.in, Spotify.com, Apple Podcasts, YouTube, moneycontrol.com, and a host of other podcast streaming platforms and directories. In this episode, we'll turn the lens on a special aspect of India's healthcare ecosystem, which is at an important inflection point. From health financing and primary care to climate-related risks, technology and equitable access, the challenge is no longer simply expanding healthcare, but building a system that can withstand what lies ahead. For over 20 years, Swasti, the health catalyst, has drawn valuable experience working in each of these domains to help prepare resilient communities and a robust healthcare ecosystem ground up. On the show today, we have Dr. Sudha Chandrashekar, who was recently appointed the CEO of Swasti. She brings extensive experience in public health domains, health economics, and policy design. She has previously served as an advisor at the Health Systems Transformation Platform, working closely with the Ministry of Health and Family Welfare and multiple state governments. Her expertise spans health financing, public-private partnerships, and large-scale health systems reform. She is also a research fellow at the London School of Hygiene and Tropical Medicine. Welcome to the show, Dr. Sudha Chandrashekar. Delighted to have you.
Thank you very much.
Let's start off with, first of all, congratulations on taking on the role of the CEO at Swasti. As you step into this new chapter of leadership, what excites you most about the opportunity, and what is the vision for Swasti's future? Dr. Sudha?
Thank you for the warm introduction, and I'm extremely happy and excited to be part of the Swasti's journey. Swasti has not been new to me. I have been involved in some of the activities way back since 2005 in different capacities. But now to move into a much more leadership role at an organization whom I have admired over the years I'm really grateful for that. So Swasti has been really looking at varied programs and also evolving dynamically to ensure that each phase of its journey has been more exciting than the other. So in that sense, looking at connecting not only evidence, innovation, but also implementation at scale. So in that way, this is an organization which I'm sure will go miles further as we move ahead together. When you look at what would be my vision for this organization, which has rooted itself in improving not just healthcare, but well-being and healthy days for all the communities we serve. And Swasti mainly currently works as a systems catalyst, not just working with government and communities, but also with the private sector and philanthropy. So in that sense, it brings in multiple stakeholders and convenes reforms so that they can be piloted, they can be accepted and scaled up and replicated at all levels. In that sense, the main focus is to have scalable and sustainable models, and more so, which needs to be locally owned either by the communities or the states who implement, or the stakeholders to whom these interventions adds value. In that sense, Swasti has a very interesting model of collaborative partnerships. So many NGOs may work in silos, but I have seen Swasti collaborating, adapting, handing over multiple projects to its owners so that the organization continues to work in more areas and strengthens them. For example, the Swasti Mahila Sangha, which was actually set up by Swasti initially and managed. Later on, it was completely handed over to a community-based organization to take the work forward. And currently, they receive a lot of their own projects and funds. So in that sense, I think it's also looking at building, scaling up, and also transferring it to the natural owners. Gaurav?
Yeah, so, you rightly put the context of what's happening and also giving a very detailed background of the kind of work that is doing. Swasti has been at the forefront of advancing health equity and systems change for over 2 decades now. What do you see as the most pressing healthcare challenges and opportunities facing India today, Dr. Sudha?
I myself have been working in public health for over 27 years now. So I have seen the shift which is happening in our country. And I still remember we working on communicable diseases as a major focus. From there to now looking at a huge number of recent challenges that has come up, especially with increasing non-communicable diseases and also the climate-related health risks that we are all now getting a piece of. These are some things that are complex problems, so there's nothing like a small solution or a simple solution for it. It needs to be handled in a much more collaborative way, involving multiple stakeholders and individuals themselves for changing their behavior and lifestyle. So these diseases are something that we really need to focus currently. And Swasti has been making sure that we foray into these areas and address these challenges. Recently, our focus also has been on looking at connections with mental health and aging. Swasti has recently partnered with the state governments of Kerala to come up with the kind of reforms which they have announced, being the first state in the country to set up a dedicated elderly care department. And we are working very closely with them to design those reforms. So in that sense, we are looking at aging and further populations who are going to live longer and will have completely different set of issues, and the states and our health system has to really cope up with these kind of new challenges. Urbanization is again a very core area, with more and more number of people moving to urban areas, and also even the rural areas transforming into small urban townships. So in that sense, there has been a significant changes and health needs of the urban poor, which also have to be addressed. And Swasti has been in the forefront. We did the first Bhopal Healthy City intervention, looking at beyond health, what are the social determinants. And recently, we also released a blueprint for how healthy cities reforms needs to be looked into. So in that sense, I would say not only as India is facing these challenges, but we are also adapting and addressing these in our own ways.
Absolutely. India has made significant strides in expanding healthcare access. That said, however, affordability and equity remain concerns, and they continue to remain. What will it take to achieve truly inclusive and sustainable universal health coverage, Dr. Sudha?
So universal health coverage, when you look at it, it's not just about giving access or insurance or just covering a part of the costs. So it has to be rooted and wherein primary health care is the foundation. And not only the treatment aspects to reduce the out of pocket expenditure needs to be covered, but also the effects of these health issues on livelihoods and related to environment health also needs to be looked into. And for UHC to be something to be achieved, we also need to look at emerging digital health interventions also. We need to make sure that the patient's journeys are seamless, connected, and coordinated so that the data follows the patient and they don't need to have issues as they go referred from to higher centers. So there needs to be the digital health, which is one of the backbone. I think India has come up with the Ayushman Bharat Digital Mission Blueprint and has initiated a lot of reforms in the digital sector. And we need to join that efforts and make sure that we use the data for better decision making and enhancing and strengthening these reforms. Of all the things, most important is to ensure UHC is not for a select few, but we have equity in access and care for all the genders, all socioeconomic status, and for everyone, so that no one is left behind. I think that is the motto of UHC we should pursue to achieve.
Absolutely. That is something that we should probably pursue at almost like a mission mode. Swasti has long championed prevention and primary healthcare. Why is it critical for India to shift from a treatment-centric approach towards one that prioritizes prevention, early intervention, and community health? Dr. Sudha?
Prevention always delivers better health outcomes and lower long-term costs. The latest concept is to ensure that we have good screening, early diagnosis, and treatment and follow-up so that we do not move a patient from delayed diagnosis and complications, so that we can ensure that patients get the right care at the right time, and for which the latest concept is to make sure that for ambulatory care sensitive conditions, we invest and put our efforts so that these do not move ahead for complications. So in that sense, as emergencies and known complications are not something that we would want to negotiate and treat, but may avoid them so that our people are healthier, and for which the key thing is behavior change at an individual level, family level, and ensuring there is health literacy and that they trust the care system in making sure that we are able to deliver it at the first point of contact. And that is the reason the Ayushman Bharat Health and Wellness Centers are really key in ensuring primary care to millions of people within our country.
Absolutely. Climate change is increasingly being recognized as a public health challenge, and rightly so. How is it affecting vulnerable communities, and what should governments and health systems be doing differently to prepare for these risks? Because these are very real now. Dr. Sudha?
Climate issues, I think everyone would have experienced, and especially with the rising heat, air pollution, and change in the vector-borne diseases itself, leads to a lot of illnesses and also the livelihood, because many of our informal workers, agricultural workers, as we are agrarian economy, right? So when they are not able to work fully, their whole livelihood gets affected. So the climate related issues needs better planning, and also we need to invest in surveillance so that we're able to give people early warnings so that they can ensure that their whole day is better planned, and the health systems are ready to handle these kind of issues. So in that sense, we need to make sure that we have a good cross-sector collaboration. So it's Also making sure that we get good records from the IMD departments, and we are able to communicate and coordinate with local departments and reach those messages in a very efficient way and in timely manner to the people who need it the most. So we need to make sure that our communities and our young people are at the center of these adaptation strategies. And climate definitely affects different people differently, and especially the vulnerable groups, women, children, elderly. The pollution effects may be completely different if you have a pre existing condition. So, in that sense, we need to be very aware of the individual risks, the community risks, and also making sure that we have a good plan in place and we follow the plan. So that kind of departments coming up with heat action plans and local solutions is very key.
Yes, and let's change tack a bit. Let's talk about something that is now got embedded in our lives, which is about artificial intelligence. Artificial intelligence and digital technologies are transforming healthcare delivery. Where do you see the greatest opportunities for AI to improve health outcomes, and what safeguards are needed to ensure these innovations remain inclusive and, importantly, ethical? Dr. Sudha?
AI should augment our efforts, and it will at no point in time can replace our human judgment, right? So we have to make sure that the AI works for us, and we use them specifically in conditions like screening, diagnostic, decision support, and ensuring we have better workforce productivity and public health surveillance. So these are things that we need to look at. How do we scale it up? How do we ensure these are very relevant to our populations and improve our frontline worker effectiveness? Recently, Swasti supported a MedTech challenge for AI solutions in health in Andhra Pradesh. So we understand that how these solutions need to be looked into and evaluated for its use in a real population. So in that sense, the ethical guidelines and the data transparency and protection act guidelines needs to be something that we need to follow. So innovation should be there and we should be adapting it, but with, as you said, specific guardrails for privacy and data security. So in that sense, we need to build responsible governance alongside the technology.
Dr. Sudha, you have worked extensively with governments, development partners, and communities. What are some of the most important lessons you have learned about driving meaningful and scalable health systems change, Dr. Sudha?
I would say sometimes opportunity, when it is presented, how do we navigate those opportunities becomes very critical. Right? So when we know that these issues are something which cannot be handled by any one individual organization or isolated projects, we need to ensure that the leadership is aware of those things and they are open to a much kind of partnership with relevant organization to scale these things up. So not only local solutions, but also we need to learn from globally or even other states. We have multiple state innovations that are available and documented, but sometimes we are not very aware of them or take it forward. Maybe it works in that state, but maybe not ours. But we need to really look at how these learnings can be contextualized and ensure that we are able to scale, because the greatest impact I have seen in any of the reform is not when we do into small projects, but at the government level when we have been able to even influence a policy to make sure that each state moves towards UHC, because even that kind of a reform needs to be embedded at the local level, at the state level, because health is still a state subject. So we need to work together and be flexible in how we design those learnings. For example, when we are looking at, maybe you can see that Ayushman Bharat, the PMJY, though it has a national guideline, the states are having a lot of flexibility in how they design this interventions, whether they need to, specifically alter those national guidelines and designs to adapt it to their states. In that sense, the key thing which should not go missing in any of these reforms is focus on community and people centric. So we should not treat them as just recipients of our programs, but we should work with them, co-create with them, take their feedbacks at every stage and evolve the program and make sure that it is something that we design together.
Indeed. Partnerships have become central to solving complex health challenges. How can governments, philanthropy, civil society, and the private sector collaborate more effectively to improve health outcomes at scale? Dr. Sudha?
I feel each organization comes up with their own strengths, right? We might have a huge impact as a part of our community engagement related strengths. Another organization may actually have a much more closer relationship with the private sector. So each stakeholder brings something to the table. And how we ensure that it is all coordinated to our objectives is a key step. One of our learnings and currently what we are doing as anchoring a virtual project management unit for Andhra Pradesh is making sure that the partnership stack for that VPMU works. In that sense, we are aware of who is doing what, where, to their strengths, and ensuring there is no duplication of activity or wastage of resources. So we pool those efforts to make sure that what needs to be delivered or supported for the government to scale up those initiatives happens. So in that sense, we have to make sure that the public interest remains central and making sure that the partnership helps not just implementing a program, but also support better governance of these initiatives at the large scale.
Absolutely. And finally, Dr. Sudha, let's look into the crystal ball and gaze into it. And in your view, looking ahead to 2030, what would success look like for Swasti and for India's healthcare ecosystem? What gives you confidence that we can get there, Dr. Sudha?
For us, we have kept a big bet for ourselves that we will improve healthy days for our communities. So for me, the success is when we add 100 million healthy days to our communities whom we work with, not just providing additional healthcare services or more health, right? So that in that way, that is what we would work towards. And for this being from the public health background and based on our experience, primary healthcare needs to be the core strategy. It needs to be embedded in communities and make sure that the prevention becomes the mainstream across policy and practice. We need more and more care services and prevention and promotion of health to be able to achieve our goals. So we hope that our health systems are supported to be climate ready, digitally enabled, and equitable. I think Swasti would like to be a trusted catalyst, shaping policy, practice, and innovation. And for me, the optimism comes from India's talent because we are already the pharma for the world. I'm sure we'll be the global talent for health for the world in the coming days. And our digital capabilities are something that many countries are also looking forward to. And our community health workforce is a key aspect and making sure that we collaborate across different sectors and make this dream of achieving universal health coverage and a healthy system and a healthy India in the coming days.
Absolutely. Dr. Sudha, thank you so much for taking the time out and dropping by to have this conversation with us and sharing a deep insights and perspectives on a range of issues. Thank you so much.
Thank you.